Urinary tract infections are caused by bacteria entering the urethra or the tube leading from the bladder to the outside in human beings and other animals.
In this video, I will demonstrate what to do when someone is bit by a snake.
Hi, I'm Tara Polak, physical therapist at Evolution Physical Therapy, here to tell you how to treat a pulled calf muscle.
When dealing with an open fracture, please refer to your local protocols. In this case, we're going to be looking at a lower leg fracture that's open.
Hi, I'm Dr. David Hill, and today we're going to be talking about how to treat the stomach flu.
The urethra in a female is usually only a centimeter or two in length, and therefore women are more prone to have urinary tract infections than men who have a longer urethra that goes from the bladder to the end of the penis.
First, assess scene safety, then call for an emergency response.
The calf is in the back of the lower leg. It's made up of two different muscles. One is the gastrocnemius and one is the soleus.
Your first consideration is to control the bleeding. I have 5x9 dressing that I'll place over the fracture site, and I'll apply direct pressure.
Now, when we say stomach flu, we really mean some sort of viral gastrointestinal illness that presents with vomiting, diarrhea, or both.
This doesn't mean that men can't get urinary tract infections or cystitis, which is infections of the bladder. We can.
Keep the victim calm and as still as possible.
Now, when you acutely pull this muscle, the first thing that you want to do is apply ice immediately or a gel pack.
Once the bleeding has been controlled, you can wrap cling right around the site.
I'm going to concentrate on the vomiting because we're talking about the stomach, and that's where vomiting comes from.
And we also get prostatitis from those same bacteria entering the prostate gland on the way to the bladder.
Remove any tight clothing or jewelry. Swelling will make these difficult to remove later.
You can do this for a minimum of 10 minutes and a maximum of 20 minutes.
If the bleeding has not been controlled at this point, don't take the dressing off. Just reapply another dressing and more pressure and keep adding on to it.
So recurrent vomiting is present in a lot of viral illnesses. Of course, it can be present in other very severe and life-threatening illnesses like appendicitis or gastric ulcer disease or pancreatitis. So if you have something that is going on too long, more than 24 hours, threatening to cause dehydration or associated with extreme pain or fever, you really need to seek care.
In my 7th life, I was a laboratory animal. To this day, every time I see a test tube, I throw up.
Hold on to that cat good and tight now, Larry. Easy now, fella. Easy there. I don't know about you, Larry, but these experiments sound like something out of a horror movie to me.
All I know is if this research goes bad, I'm going to put plenty of distance between me and this laboratory.
A few other medications.
Every snake bite is different, so be prepared to identify what the snake looked like to emergency personnel. This will help them provide specific treatment.
I'm Tara, and this is how to heal a pulled calf muscle.
Can you feel me touching you?
I can.
And can you please move your toes?
Talking about how to treat the stomach flu, I'm Dr. David Hill.